Duloxetine 60 mg capsule delayed release sprinkle is a medication that is used to treat depression, anxiety, and nerve pain in people with diabetes or ongoing pain due to medical conditions such as arthritis, chronic back pain, or fibromyalgia. It may improve your mood, sleep, appetite, and energy level, and decrease nervousness. This medication works by helping to restore the balance of certain natural substances, serotonin and norepinephrine, in the brain. It is important to take this medication as directed by your doctor and at the same time each day. Before starting to use duloxetine, make sure to read the medication guide and any instructions for use provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually 1 or 2 times a day. You can take it with or without food, and if you experience nausea, taking it with food may help. You can swallow the whole capsule, or you can open it and sprinkle the contents on a tablespoonful of applesauce, then swallow the mixture right away. Do not crush or chew the mixture, and do not prepare it ahead of time. Your dosage will be determined based on your age, medical condition, and how you respond to the treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important to take this medication regularly at the same time each day to get the most benefit from it. Even if you start to feel better, continue taking the medication as prescribed. Do not stop taking it without consulting your doctor, as some conditions may worsen when the drug is suddenly stopped. Your doctor may need to gradually reduce your dose to prevent symptoms such as dizziness, confusion, mood swings, and headache. If you experience any new or worsening symptoms, be sure to report them to your doctor. If your condition does not improve or if it worsens, make sure to inform your doctor. You may experience side effects such as nausea, dry mouth, constipation, loss of appetite, tiredness, drowsiness, or increased sweating. If these effects persist or worsen, notify your doctor. Dizziness or lightheadedness may occur, especially when starting or increasing your dose. To reduce the risk of these symptoms, rise slowly when getting up from a sitting or lying position. Remember that the benefits of this medication outweigh the risk of side effects. Many people using this medication do not experience serious side effects. Monitor your blood pressure regularly as this medication may raise it. Alert your doctor if you notice high blood pressure readings. Contact your doctor immediately if you experience serious side effects such as confusion, easy bleeding/bruising, decreased interest in sex, changes in sexual ability, muscle cramps/weakness, shaking, tremor, difficulty urinating, signs of liver problems, black stools, vomit that looks like coffee grounds, seizure, eye pain/swelling/redness, widened pupils, vision changes, fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, unusual agitation/restlessness, rash, itching/swelling, severe dizziness, trouble breathing, skin blisters, or mouth sores. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. Contact your doctor or pharmacist about all the drugs you are taking to minimize the risk. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so contact your doctor or pharmacist for any other effects not listed. In the US, call your doctor for medical advice about side effects. In Canada, call your doctor for medical advice about side effects. Antidepressant medications like duloxetine 60 mg capsule, delayed release sprinkle, are used to treat depression and other mental/mood disorders, and can also help prevent suicidal thoughts and provide other important benefits. However, it's important to be aware that a small number of people, especially those younger than 25, may experience worsening depression, other mental/mood symptoms, or suicidal thoughts when taking antidepressants. It's crucial to discuss the risks and benefits of antidepressant medication with your doctor, especially if you're younger than 25, even if the treatment is not for a mental/mood condition. If you notice worsening depression or other psychiatric conditions, unusual behavior changes, or other mental/mood changes like new or worsening anxiety, panic attacks, trouble sleeping, irritability, hostility, impulsive actions, severe restlessness, or very rapid speech, it's important to tell your doctor right away. Be especially watchful for these symptoms when starting a new antidepressant or when the dose is changed. As for the daily dosage and timing, it's best to follow your doctor's instructions and take the medication at the same time each day. Before taking duloxetine, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any other medications you are taking. This medication can have an impact on various medical conditions, such as psychiatric disorders, bleeding problems, glaucoma, high blood pressure, kidney and liver disease, seizure disorder, and stomach problems. Duloxetine may cause dizziness or drowsiness, so it's important to avoid alcohol and marijuana while taking it. If you have diabetes, it's important to monitor your blood sugar regularly and talk to your doctor about any necessary adjustments to your medication, exercise, or diet. Before undergoing surgery, make sure to inform your doctor about all the medications you are taking. Older adults may be more sensitive to the side effects of this medication, and there is a risk of mineral imbalance and increased risk of falling. Children may also experience side effects such as loss of appetite and weight loss. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor. It's crucial not to stop taking this medication without the guidance of your doctor, especially if you are dealing with mental health conditions. If you have any concerns about using this medication during pregnancy or while breastfeeding, consult your doctor. When taking duloxetine 60 mg capsule, delayed release sprinkle, it's important to be aware of potential drug interactions. This medication may interact with other drugs that can cause bleeding or bruising, such as antiplatelet drugs, NSAIDs, and blood thinners. It can also affect the removal of other medications from your body, which may affect how they work. Examples of affected drugs include certain antibiotics, antiarrhythmic drugs, antipsychotics, and tricyclic antidepressants. It's important to avoid taking MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Additionally, the risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin, such as certain street drugs, St. John's wort, and certain antidepressants. If you are using other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, or drugs for sleep or anxiety, it's important to notify your doctor or pharmacist. Aspirin can also increase the risk of bleeding when used with this medication, so it's important to follow your doctor's instructions if you are taking low-dose aspirin for heart attack or stroke prevention. If you or someone you know has taken too much of this medication and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, fainting, seizures, and a fast heartbeat. It is important not to share this medication with others. While taking this medication, it is important to have regular lab and/or medical tests, such as blood pressure and liver function. It is also important to keep all medical, psychiatric, and lab appointments. Make sure to consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store duloxetine 60 mg capsule, delayed release sprinkle at room temperature, away from light and moisture. Be sure to keep it out of reach of children and pets. When you no longer need the medication or it has expired, be sure to properly discard it as instructed by your pharmacist or local waste disposal company. Avoid flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.